Welcome to our new video. So myself Dr. Subin. So today we are going to discuss about diabetes and its complication and how we can prevent its complication through Ayurveda, the indigenous system of medicine. So as you all know, diabetes is a lifestyle disorder and it's a metabolic disease. So coming to the type of disease, diabetes, there are several types of diabetes you can see. So first one is type 1 diabetes, that is juvenile diabetes, that will start in the early ages, in the sense of childhood only it will start. So that is juvenile diabetes. In that what happens, the insulin production itself will completely stop because of various reasons, maybe autoimmunity, maybe genetic or other reason. And in type 2 diabetes, there will be insulin resistance and less production of insulin. So most probably what happens, our lifestyle, sedentary lifestyle, lack of exercise, stress, everything contribute to the for the type 2 diabetes. Another type of diabetes is gestational diabetes, the diabetes which is coming in the pregnancy. So that can be managed well with the medicines or insulin. So these are the basic type of diabetes. And coming to the complication of diabetes, as you all know, if diabetes is not controlled for long time, it will affect the various parts of our body. Mainly it will affect our nerves, it will affect our eyes, it will affect our kidney, it will affect the heart, it will affect the brain, and all over the body, all system will be affected by uncontrolled diabetes. So keeping the diabetes under control is the main thing in diabetes mellitus. So diabetes mellitus we can control with food, control with exercise, control with proper lifestyle, and control with medicines and insulin. So we have to do regular checkup of blood in a diabetic patient. So most of the patients are unaware of they are diabetic. That is the main problem. So this November 14th, next coming Sunday, we are all world is celebrating International Diabetic Day for the awareness of public towards the diabetic. So as I told, most of the people don't know they are diabetic. We are getting patients in clinical practice regularly. The patients are coming with fasting blood sugar 250, 260, and they are not that much serious about their blood, blood condition or sugar level. So that is the lack of awareness towards diabetes. So they don't know what will happen if the sugar level is keep on going like this. They are just thinking that it will be I can manage with my food, I can manage with exercise. Even though they are doing fasting, they are doing proper exercise, then also if the blood sugar level is high, they have to consult the doctor. That awareness is not there among the public now also. So that is very important. So after monitoring the blood sugar level, if it is higher than normal level, for example fasting, if fasting blood sugar is more than 120 or 125, so you have to be cautious about your blood sugar. So one or 2 months you can try with your exercise and food control. Then also it is not under control, you have to go to a physician, you have to go to a doctor for the consultation compulsory. Otherwise it will lead to lot of complication in your life. It can change your life. So that is what I am telling. I am talking about the complication of diabetes. So there are various complications of diabetes. The main diabetic complication, around 30% of diabetic patients are suffering with diabetic neuropathy. Diabetic neuropathy in the sense that because of the impaired blood circulation of microvascular circulation, it will affect the nerves, our peripheral nerves, it will affect. So the nerve will not get the proper blood supply. Because of that, it will diminishes in function, so that the nerve will get irritation and inflammation, and the nerve function will decrease. This condition is called diabetic neuropathy. Mainly the patient will have the symptoms like severe burning sensation of foot or palm or legs, and they will have numbness, lack of sensation, and sometimes body pain, sometimes burning pain. So all these symptoms are related to neuropathy symptoms, diabetic neuropathy. So what happens later? It will leads to necrosis of the tissue. It will leads to amputation. So many other complications. And another complication is diabetic retinopathy. So it will affect. So slowly the vision will become blur, and we cannot properly see, and our complete eyesight will go. That is called as diabetic retinopathy. Another case is diabetic nephropathy. So what happens? The uncontrolled diabetes gradually affect our kidney function. The filtering capacity of the kidney will reduce, the creatinine will increase, the GFR will reduce. So the kidney will also affect, and that will end up with ESRD, end stage renal disease, and the patient will end up with dialysis and other complication. And diabetic patient is always prone to get a heart attack. So cardiovascular problems also is a complication of diabetic, and they are also prone to get stroke, that is cerebrovascular accident, paralysis and all other complication. And some diabetic patient, that is diabetic type 3, there is a new diabetic type 3 which is causing the brain also, the brain cells also will be affected with the diabetes, and along with the diabetic the patient will have dementia, Alzheimer's kind of symptoms also. So that is also a probable complication of diabetes. Coming to the prevention point of view, in Ayurveda, that is elaborately mentioned about the diabetic treatment, that is Madhumeha Chikitsa or Prameha Chikitsa. In our Acharyas, 5,000 or 6,000 years back, they have elaborately mentioned about the treatment protocol of diabetic patient, Prameha Rogi, how we have to consider the Prameha Rogi, how we have to manage the lifestyle modification, what are the medicines required, everything is elaborately mentioned in Ayurveda. So I will tell you some basic points to reduce the complication of diabetes, or to keep the diabetic patient as a healthy person. So the main thing is our lifestyle modification only. So lifestyle modification in the sense, we have to do regular exercise, adequate exercise, minimum or 1 hour in a week, in per day, is very important for a diabetic patient to keep healthy, because this exercise will improve the blood circulation towards the muscles, and it will reduce the blood sugar level. It can improve the overall performance of the body by physically fit. So minimum 1 hour exercise regularly should be done by a diabetic patient from the day 1, because from the day 1 onwards the diabetic patient is a patient of kidney, a patient of neuropathy, a patient of eye, everything. So you have to consider like that, because day 1 onwards, the diabetic patient, day 1 onwards, they are prone to get the complication like this. So regular adequate exercise is a very important thing in controlling diabetes. Another thing is controlling the diet. As you all know, we cannot completely become a diabetic diet dependent patient in our life, because practically it is very difficult. At least one time you have to take a very well mannered diabetic food, and other time also maximum reduce the intake of sugar and other products. As you all know, carbohydrates maximum reduce, and take more fiber rich food which is less calorie and which is easy to digest, and which is less spicy, less salty and less sugary. So you have to take more bitter taste food and more fiber rich food like vegetables. Include more vegetables in your diet, maximum include more salads, and some fruits also you can include, like citrus fruits you can include in your food. And try to take old rice instead of new polished rice. Try to take old brown rice. You can take ragi. Ragi is the best food for the diabetic patient, and millets you can take. So like this you have to modify your diet in a diabetic patient. Another thing is keeping the body weight ideal. So you have to keep the body weight ideal. The obesity is always a reason for diabetic. If you are obese, you are more prone to get diabetic. So keep your body weight BMI normal, and by keeping the balanced diet and regular exercise. Another important thing is, according to Ayurveda, regular abhyangam. Abhyangam in the sense application of medicated oil. So in Ayurvedic shops, you can consult a Ayurvedic doctor, and they will prescribe you medicated oil which is suitable for the body. So this medicated oil you have to apply regularly over the head and body. So this is called as abhyangam, that is body massage. You can do regularly to keep your body well circulated, and your muscles well toned muscles. You will be getting you can reduce the complication of diabetes by doing this. And another important thing is Pada Abhyangam. Whenever you are doing Abhyangam, you have to do Abhyangam over your foot also. Foot massage. It's very important because, as you know, a main complication is diabetic foot. So in order to prevent the diabetic foot, if you are massaging with the oil regularly your foot, it will increases the blood circulation. It can stimulate the nerve endings, and it can stimulate the vision also, because lot of nerve endings are there for the vision ends up in the foot. So that also we are experiencing in our clinical days, that the patient who is doing regular body massage and regular foot massage is well benefited with the Ayurvedic way of prevention of complication of diabetes. Another thing is Panchakarma treatment. So in the presence of a well qualified Ayurveda doctor, you can purify your body by doing Panchakarma treatment like Vamana, Virejana, Vasti and all. So this continuous Panchakarma treatment can reduce the oxidation process of tissue, and it can save the tissue by the complication of diabetes. That is also very important. And another thing is Rasayana Chikitsa. In Ayurveda, there is a special branch called Rasayana. So regular Rasayana Chikitsa you can practice through the Ayurveda, like Triphala, Guduchi, or some Balladaga kind of medicines you can regularly take to prevent the complication of diabetes, along with the conventional allopathic treatment. So this is all about diabetic complication prevention. So if you are having any doubts, you can comment in the comment box. Thank you very much for seeing our videos, and if you want more information, you can contact us. Myself, Dr. Subin, Kottakkal Ayurveda Shala, Secunderabad branch. Signing off. Thank you.